I'm a urologist, and for more than 20 years, I've worked with thousands of men in their 40s, 50s, even 70s who quietly struggle with the same problem. They don't truly understand what's happening inside their bodies. When their natural response starts to fade, most men stay silent. Some turn to pills, others hide it out of shame. A few simply accept it. I'm getting older, this is normal. But science tells us something different. Your body isn't broken, it's just forgotten how to activate itself. This decline doesn't happen overnight. It's the result of years of accumulated stress. Poor sleep, alcohol, tension, lack of exercise, sitting too much, even shallow breathing. Then, one morning, it all feels quiet. But aging isn't the end. If you understand the right way to reawaken your body's natural systems, you can restore function without medication, without invasive treatment, simply by retraining your own physiology. To understand why this 60-second method works, you must first know the 3 key systems that control male performance. The nervous system. Arousal begins in the brain. Nerve signals travel through the spinal cord to the pelvic area. As you age, these signals become weaker and slower, like old telephone wires losing clarity. The circulatory system. For natural erections, blood must flow quickly and fill the erectile chambers. After 40, blood vessels stiffen, lose elasticity, and circulation weakens. The pelvic floor muscles. These muscles at the base of your pelvis help control blood flow and maintain firmness. When they weaken, you lose control and endurance. When these 3 systems fall out of sync, the body forgets how to respond naturally. The goal isn't to force it with drugs, it's to reconnect the pathways. And that's exactly what perineum massage does. The perineum is the small area of skin between the scrotum and the anus. Beneath this thin surface lies the prostate gland, deep pelvic muscles, nerves, and blood vessels that control arousal and function. When blood flow slows, the nerves weaken, and the prostate becomes congested. Automatic responses begin to fade. Gentle stimulation of the perineum helps increase blood circulation to the entire pelvic region, reduce congestion around the prostate, activate dormant nerve signals, strengthen pelvic floor muscles through natural contraction and release. That's why Eastern medicine calls this point the gate of life, and modern anatomy calls it a neurovascular hub. A central connection point for male vitality. This method works through 3 core mechanisms. Nerve activation. Gentle pressure on the perineum stimulates the pudendal nerve, sending electrical impulses to the spinal cord that wake up dormant pathways. Improved blood flow. Circular motion and sustained pressure expand microvessels, increasing oxygen and nutrients to the prostate and surrounding tissues. Pelvic muscle training. The rhythmic motion tones and strengthens deep pelvic muscles responsible for blood retention. Decongestion of the prostate area. Regular stimulation reduces buildup and promotes natural drainage, decreasing inflammation and discomfort. This is not a gimmick. It's a neurovascular exercise, simple, safe, and surprisingly powerful. Step 1. Prepare your body. Sit or lie on your back with knees slightly bent. Relax your shoulders. Inhale slowly through your nose, hold for 2 seconds, then exhale gently. Step 2. Locate the spot. Use your index and middle finger. Find the soft area between your scrotum and anus. You'll feel a slightly firm cushion underneath, that's your perineum. Step 3. Apply pressure and motion. Press firmly but not painfully. Make small circular motions clockwise for 30 seconds. Then counterclockwise for another 30 seconds. Step 4. Breathe with the motion. Inhale for 4 seconds, hold for 2, exhale for 6. The warmth and tingling you feel is blood flow being restored. Step 5. Frequency. Twice daily, once in the morning, once before bed. Each session only 60 seconds. Continue for 30 days consistently. Week 1. A mild tingling or warmth in the pelvic region. Circulation begins to improve. Week 2. Morning responses return. Confidence increases. Week 3. Natural reactions become more automatic, less forced. Sleep improves. Week 4. Sustained firmness, renewed energy, stronger voice, and improved mood. This process retrains your body's reflexes, like teaching it to breathe deeply again after years of shallow breaths. Kegel exercises. Contract the same muscles you use to stop urinating midstream. Hold for 3 seconds, release for 3 seconds. Do 10-15 repetitions after the massage. Brisk walking or stairs encourages blood flow to the pelvis. Warm baths. Heat dilates blood vessels, enhancing massage effects. Hydration. Drink at least 2 liters of water per day. Proper sleep. Deep sleep between 10 p.m. and 2 a.m. boosts testosterone production. Science confirms that specific nutrients directly support testosterone, blood flow, and nerve health. Zinc. Oysters, pumpkin seeds, cashews. Supports testosterone synthesis. Magnesium. Leafy greens, bananas, soybeans. Relaxes vessels, reduces stress. Omega-3. Salmon, flax seeds. Improves blood circulation. L-arginine. Chicken, peanuts, almonds. Promotes nitric oxide production. Vitamin D. Morning sunlight, eggs. Regulates hormone balance. Avoid alcohol, tobacco, processed sugar, and junk food, all of which suppress male hormones. Avoid if you have open wounds, inflammation, or post-surgery around the pelvic area. Consult a doctor if you have prostate disease, diabetes, or cardiovascular issues. Do not press too hard or exceed 2 minutes per session. This massage complements medical care, it doesn't replace it. Performance decline isn't about losing manhood. It's about losing biological balance. When hormones, circulation, and nerves fall out of harmony, the body loses its rhythm. Perineum massage restores function at the source by addressing the real cause. Poor blood flow and nerve inactivity. That's why its effects are more sustainable than temporary stimulants. Mr. James, 58 after 3 weeks, natural responses returned, blood pressure normalized, and sleep improved. Mr. Michael, 56 previously dependent on medication, now confident and medication-free. Mr. Thomas, 70 practiced gentle stimulation daily, reported easier urination, lighter abdomen, and improved vitality. Their secret? Consistency and correct technique. When blood flow and hormone balance improve, the brain releases serotonin and dopamine, chemicals that regulate happiness and motivation. As a result, men not only regain energy but also clarity, focus, and calmness. Many report enhanced sleep, better memory, and stronger relationships. Healing the body often means healing the mind. Make a promise to yourself. Just 60 seconds in the morning, 60 seconds at night for 30 days. Week 1, awareness and connection with your body. Week 2, noticeable warmth and response. Week 3, natural activation without effort. Week 4, full synchronization of body and mind. This isn't a miracle, it's science through discipline. The male body is a brilliant system. It doesn't need to be fixed, only reawakened. There's no expiry date for vitality, only the loss of awareness. The perineum massage is a safe, evidence-based practice, recommended by specialists worldwide. It helps men reclaim confidence, control, and health naturally. 1 minute a day for a lifetime of confidence. Don't wait for a miracle. The miracle is your own consistency.